Pneumonia is an infection of the lungs. It can be serious, even life-threatening, especially for young children, older adults, and people with weakened immune systems. When someone has pneumonia, the tiny air sacs in their lungs, called alveoli, become inflamed and fill with fluid. This makes it hard to breathe and the body doesn't get enough oxygen. There are many different causes of pneumonia, but the most common are viruses and bacteria. Viral pneumonia is usually milder than bacterial pneumonia, but it can still make people very sick. Bacterial pneumonia can be more serious, especially if it's not treated right away. Symptoms of pneumonia can vary depending on the cause and how severe it is. Some common symptoms include cough, fever, chills, shortness of breath, chest pain, and fatigue. Anyone experiencing these symptoms, especially if they have difficulty breathing or a high fever, should see a doctor right away. Pneumonia is a common illness, affecting millions of people each year. While it can be serious, most people recover with appropriate treatment. Understanding the causes, symptoms, and treatment options for pneumonia is crucial for early detection and effective management of the condition. Diagnosing pneumonia typically involves a combination of a physical exam, medical history review, and diagnostic tests. Doctors will listen to the patient's lungs with a stethoscope for any abnormal sounds, such as crackling or wheezing. They'll also ask about the patient's symptoms, including when they started and how severe they are. In addition to the physical exam, doctors may order a chest X-ray to confirm the diagnosis of pneumonia and determine the extent of lung involvement. The X-ray can show areas of inflammation or fluid in the lungs. In some cases, doctors may also recommend other tests, such as a blood test or a sputum culture. A blood test can help identify the presence of infection and determine if the body is fighting it off effectively. A sputum culture involves examining a sample of mucus coughed up from the lungs to identify the specific type of bacteria or virus causing the infection. This information can help guide treatment decisions and ensure the patient receives the most effective antibiotics or antiviral medications. Accurate and timely diagnosis of pneumonia is crucial for initiating appropriate treatment and improving patient outcomes. By combining a thorough medical history, careful physical examination, and targeted diagnostic tests, doctors can effectively identify and manage pneumonia, reducing the risk of complications and promoting a speedy recovery. Treatment for pneumonia depends on the underlying cause, the severity of the infection, and the patient's overall health. For bacterial pneumonia, antibiotics are the primary treatment. The specific type of antibiotic prescribed will depend on the bacteria causing the infection. In addition to antibiotics, treatment for pneumonia may also include supportive care measures to help relieve symptoms and promote healing. This may involve getting plenty of rest, drinking fluids to stay hydrated, and taking over-the-counter medications to reduce fever and pain. For viral pneumonia, antibiotics are not effective. Treatment typically focuses on managing symptoms and supporting the body's natural healing process. This may include rest, fluids, and over-the-counter medications to relieve symptoms such as fever, cough, and aches. In some cases, antiviral medications may be prescribed if the infection is severe or the patient is at high risk for complications. It's essential to complete the full course of antibiotics or antiviral medications as prescribed by a doctor, even if symptoms improve before the medication is finished. Stopping medication early can lead to the infection returning or becoming resistant to treatment. Viral and bacterial pneumonia are both infections of the lungs, but they're caused by different types of germs and, they actually require different treatment approaches. Viral pneumonia is caused by a virus like the flu virus or respiratory syncytial virus, which we often call RSV, while bacterial pneumonia is caused by bacteria such as Streptococcus pneumonia or Haemophilus influenza. Now, the symptoms of viral and bacterial pneumonia can be pretty similar, but there are some key differences. Viral pneumonia often starts with flu-like symptoms, so things like fever, cough, and muscle aches, and these may gradually get worse over a few days. Bacterial pneumonia, on the other hand, can come on more suddenly and may cause more severe symptoms such as high fever, chills, and chest pain. When it comes to treatment, the approach is also different. Antibiotics are effective against bacterial infections, but they don't work for viral infections. For viral pneumonia, treatment usually focuses on managing symptoms and supporting your body's natural healing process, and sometimes antiviral medications may be used. Understanding the differences between viral and bacterial pneumonia is really crucial for making sure patients receive the right treatment. So, if you suspect you or someone you know may have pneumonia, it's essential to see a doctor for an accurate diagnosis and treatment plan. Preventing pneumonia is, honestly, always better than treating it. There are several steps you can take to protect yourself and your loved ones from this potentially serious infection. Getting vaccinated against pneumonia and other respiratory viruses like the flu is actually one of the most effective ways to reduce your risk. Practicing good hygiene habits, such as washing your hands frequently with soap and water or using an alcohol-based hand sanitizer, can also help prevent the spread of germs that cause pneumonia. It's important to cover your mouth and nose when you cough or sneeze, and to avoid close contact with people who are sick. Maintaining a healthy lifestyle, eating a balanced diet, exercising regularly, and getting enough sleep can really boost your immune system and make you less likely to get infections, including pneumonia. And if you smoke, quitting is honestly one of the best things you can do for your lung health and your overall well-being. By following these simple tips, you can significantly reduce your risk of developing pneumonia and stay healthy all year round. Remember, prevention is key when it comes to protecting your respiratory health.